everyone. So today I have the pleasure of having with me Dr. Angad. Dr. Angad absolutely thrashed this July's FMG and with an amazing score of 221. And and I had the opportunity, he texted me on Instagram, I had the opportunity to interview him on how he prepared, on what his journey was, especially considering this FMG was somewhat lower pass percentage. And maybe even in this, if it in this low pass percentage, he could get an amazing score of 221. That just shows how brilliant is and how good his preparation was. So his strategies, his mantra can be actually applied to pretty much any exam, I would say. Any form of FMG exam that might come into the future. So hi Angad, how are you? How are you feeling?
So, sir, it is such an honor to actually have an interview done by you. And always used to dream it whenever I used to see in third year, fourth year, a group of friends used to see it together. कि यार एक दिन आएंगे तो फिर मजा आ जाएगा. And like it's like dream come true today.
Thank you. Thanks a lot. So, Angad, can you tell me, like, I'll start with it from the beginning. Can you tell me where did you do your undergraduation from? And a bit about that college. Let's say someone wants to go to that college or किसी को is thinking about doing the FMG route. So, a review about that college. थोड़ा वो भी हो जाएगा. Yeah.
Ji sir. I have done my MBBS from Davao Medical School Foundation, which is in Davao City in Philippines. So as like most of the FMGs know that in the past 4 to 5 years, most of the top 10 are coming from DMSF itself, and that at least that speaks for itself. In fact, my young sister is also there from DMSF only. That's why my dad also touched about it because it's good renowned, not only like with respect to the theory which they teach, the clinicals, and I really believe the clinicals which they taught us that time in second year, third year, and fourth year really helped me to crack my exam as well. And with respect to the infrastructure only, like like earlier people used to go just for the infrastructure, but definitely they have improved with respect to the clinical applications because they have an US oriented system. So that is why, like I guess, when people used to also recommend over their first aid, so that was also really useful because not only it helps in the US assembly, but it actually helps in all competitive exams because it gives you the basic of all medicine which you need. So yeah.
So I think your MBBS college also contributed to the success. So coming to the main question, which you can take, like keep under this time the FMG pass percentage, which a lot of people got disappointed since last time it was over 30%, but this time it has gone to around 10%. But still you got a 221 score. So basically it shows that this exam is not something which is inconquerable. It's still a conquerable exam. What do you think you did different as compared to the other aspirants probably this time, that resulted in, and maybe a bit about the exam, that resulted in you scoring so high and like I said in the beginning, absolutely thrashing the exam? Like, what was the thing that you feel made you different? Your
Sir, in
Yeah.
sir. So in one, if like you want to say like a mantra, I would say is that I forgot about the exam completely. Like one thing which I noticed, many people they get anxious about focusing on like what I'm going to do on the main exam on the judgment day. I say people don't forget about the exam. Every day is a judgment day. It really determines on how you do your day. Like I learned this in third year from you, the Pomodoro technique. 30 minutes, 30 minutes. I used to keep a chart, sir. In
Mhm.
that chart, I used to have like effective, I want to study 7 to 8 hours a day. Once I used to complete that goal, all the books closed, I can do whatever I want. So, sir, even that 7 to 8 hours a day, it used to take around 12 to 13 hours because when I'm saying 7 to 8 hours means, sir, that's effective 7 to 8 hours. Like discipline, like as you say, like the break should be specifically 5 minutes, not 6 minutes, not 5.5 minutes, 5 minutes.
Right.
So I used to keep that, sir, 8 hours a day. And once I used to get that done, even though I used to see other people studying, maybe because there are different type of people in the hostel. Like some people study at night, some people study in the morning. So I was a morning person, and when I used to see even other people studying, I never used to get anxious. I was like, I have done my part for today. I can watch a movie. I can just sleep. I can do whatever I want. So that was the main thing, sir.
All right, great. So basically, you did not take the anxiety or the exam on the exam day, and that non-anxiety, but taking every day in the exam day made the exam day a normal day, and that resulted in you getting through. How do you think this year's
Definitely.
FMG was slightly? Do you think this July FMG was slightly different from other FMGs? And how did your approach, your preparation, help you in that? Like a lot of people are saying, it was either tough, more clinical. What are your views on this year's FMG? How was it like that?
Doc, honestly, I would give it as a moderately high level. not like very tough, but a moderately high level, because it was like based on both of them. Like if I compare both of the subjects, both of the papers, paper one and paper two, I felt the paper one was comparatively more tougher, and comparatively better was the second paper. And honestly, sir, I really believe those people who had a clinical knowledge rather than theoretical knowledge, the person who was able to correlate two subjects or two to three subjects more, was able to crack this paper much more easily. Because, like, sir, especially like with respect to the first paper, there were like paragraphical questions in which you had to correlate multiple questions, multiple subjects, and then only you're able to crack the subject. So that's why, sir, I believe that right now the pattern, rather than like 5 to 6 years back when you used to do, nowadays the people don't even recommend to solve past 5 years, because the pattern is completely changed. In fact, in this time, I don't feel there was any pattern to be followed, because earlier people say at least 50 to 60% is PYQs, and I was barely able to count only 15 out of 300 questions this time as PYQs. So, sir, I really feel like people who are following that trend, right, like just study PYQs, study PYQs, study PYQs, they fell back because they did not understand the concepts, and their conceptual basis were, I guess, a bit it was challenged, to be honest, in this paper.
So you talked about that this time, basically, it was a more clinical paper. It was a rather very different paper. So since it was a clinical paper, the two subjects that daunt a lot of people, the basic one is the medicine one. So as far as medicine is concerned, how did you, what was your approach towards medicine? Because like I said, you said it was a clinical paper. So if your medicine is strong, it is going to be pretty much take care of a lot of portion, maybe your first paper as well, and obviously the second paper as well. So how was your approach towards medicine? What helped you in medicine?
Sir, honestly, as I said, the correlation. Like I learned all the subjects based on correlation, basically, because even in the because physio comes in the first paper, but even medicine comes in the second paper. You were not be able to differentiate. Okay, this is a medicine or physio question. It was like clinically such an oriented. You can, if you're logically understood, like, okay, there is a physics behind this, and there is the clinical case oriented behind this. So you're easily able to crack it. To be honest, I felt medicine was on the easier side this time in this exam level. Usually, sir, what they do is that they, for the major subjects, they give it around 30 questions, but this time for medicine, like a subject, around 35 questions were there, and 50 questions were there for surgery, and which is usually around 30 questions. So, and mostly were clinically oriented. Like they asked, in which in surgery also they considered physio. They talked about blood. Literally, the like, I'm repeating this again, but the correlation of 3 to 4 subjects really helped me to crack this exam.
All right. So, what was your strategy towards medicine? Which faculty or which, how did you study medicine? Like you talked about the integrated part, but any particular faculty that you particularly liked, or anyone that you would want to take the name or something?
So, like, I don't think this is only specific for FMG either. It's whatever exam. Like, we have one god of medicine, which is Dr. Deepak Marwa, a faculty member of Prep Ladder. It was like actually a basic like a call for him, because having not only conceptualized a concept and also simplified and crisp, like, which you are able to revise. Because like I have seen your videos in which you have emphasized multiple. If you start early, you can study a lot, but you need to study such thing which you can revise in last 10 days. So there are multiple platforms where there is a lot of great doctors who teach medicine, but to have a simplified all the important stuff, I could only find that in Dr. Deepak Marwa's classes.
All right. So you basically say that why medicine is so vast, it is like in Prep Ladder, in Dr. Deepak Marwa, he's the guy who actually is able to make it concise enough so that you're actually able to revise in the last 7 to 10 days.
Definitely. It doesn't feel also like, sir, like a rapid revision, like in which you're running fast. It's like he's making you actually like be on the situation right now there. You want to have fun also, you want to understand also, and he makes it in such a way that you tend not to forget that again. So revision also is reduced because of the way he teaches.
The way he teaches. Great. Since we are talking about rapid revision, we're talking about concise. The one thing, and you already talked about it a bit, can you tell us, like, should an FMG use first aid, and with subjects for first aid, and who would introduce you to first aid?
So I would start with the last one. You were the one who started, you were the one who made me actually introduced to first aid, because earlier there was a dilemma that, okay, first aid is only used for USM. But then after I saw your videos, I saw your colleagues' videos, and also you can actually correlate it to give an Indian exam. So I started it in fourth year mid, because in DMSF, actually one reason why I feel that the most of the FMG toppers come through DMSF is because the exam levels over there are quite competitive. You have in literally 1 week around 4 to 5 exams. And in DMSF, the way how in India it is theoretical based exams, over there they're starting from the first year itself. So they start with an MCQ based pattern. So people will be able to at least eliminate two questions, and they'll be only confused
Prepared
maybe
for
in
an
the last two.
MCQ based exam, basically from the very beginning.
Bilkul, sir. From the very beginning. So that's why people are well oriented with the exam. And so I started in the fourth year, and but then to be honest, I won't lie, I was be able to do it properly. I was really stressed with my lectures also, which were actually in the DMS, because they also have a different set following the set of books. So I started with that's why the set we had Harpers over there, and Harpers were kind of very hard to mug up and all. So I used first step for that. And because in first aid, why I used it? Because it had everything in one paper, rather than you have to flip when multiple papers in Harper, and they will a small one, okay, highlighted in black. Rather than that, how I annotated it in was I used three highlighters, in which one in different colors, it could be any, in one which I was easily able to forget, in one which previous year questions have been asked, and in one which I this can ask. I used to the best pattern the sir I used to study was, I used whenever I'll study a paragraph, I'll be like, how can a doctor trick me in this, and how can a question come in this?
Okay.
If a question doesn't make sense, then I never used to study that also, and it literally did not come also in the exam.
So you basically, when you're using your first aid, you basically use it in such a way that this is the volatile part, underlined separately. This is the IQ part, and this is where they are going to trick me. And the fact that your MBBS college also had a lot of MCQ based exam helped you, especially in biochemistry and other preclinical subjects.
Yeah.
Right. The next question I'm going to ask you is about previous year question. We have already talked about a bit about the previous year question part, and you said that FMG has not has totally changed the pattern. So past 5 years question of FMGs are not important. But would you say that maybe the previous year questions of FMGs are not important, but past 5 years of INI CET and NEET PG previous year question and topics become important because the paper is becoming clinical in FMG?
Definitely, sir. So to be honest, I never actually started preparing for FMG. When I started in third year, in the mid year of my second semester of my third year, I started preparing for NEET PG, because what my logic was, if I'm able to, crack a mountain, if I'm able to give the subjects, if I'm able to be prepared for the NEET PG exam, I'll be able to, because 2 years back, sir, there was actually good difference. Ki NEET PG levels are slightly more tougher. FMG is going to be a lower examination. So that's why I was like, what if I study for NEET PG exam? So I'll be easily able to crack for the FMG exam. So that was my logic, sir, when I started my preparation. And so definitely, I would not say that FMG PYQs are not useful. Definitely, it will give you an idea, because to be honest, we can never decide what question can come. So it's always good to be be prepared. So I would definitely recommend everyone that at least if you should go with 5 years of FMG, 5 years of NEET paper, and at least if you don't have time, at least 3 years of the last INICT exam. Because now, so the logic is the board is now common. And if this paper, they can ask this, why can't they ask in this paper?
This paper. So basically what you're saying is that instead of focusing just on past 5 year papers of FMG, it should not be PYQs of FMG, it should be PYQs of NEET PG and INICT. That is going to help you in
combination
in FMG.
Definitely.
And obviously after FMG, if you're going to prepare for NEET PG also, they are going to be really
फायदा तो होने वाला है.
Yeah, फायदा तो होने वाला है. They are going to be helpful in that as well. Apart from this, I would say that is there any platform which you felt that for PYQs it's good, or it's where did you practice your previous year question from? Where did you give your GTs from?
So to be honest, if I'll talk about the PYQs, and if you see that in Prep Ladder, they have actually a function like this in which you can actually separate, like if you want FMG, if you want, like they have given everything over there. So rather than checking in Telegram for some PDF to get this paper, this one, they have the proper set of this year, and you can attempt it and you can bookmark it as well. So in the bookmark, what I used to do was, not all PYQs are tough, or not all PYQs you need to revise it again. So in one of your videos also, you told this in which you feel that you're able to do it right now. No need to save this also. So because that time also, if this comes in the exam, you will be able to do it there also. So I never used to bookmark those in which I used to take at least more than 1 minute, because the exam also was 1 minute based. So those in which made me think more, and those which I was out of the box, I used to bookmark them and I used to keep it.
So basically, you were saying that in case of as far as previous year question and its practice is concerned, instead of running after Telegram PDF, PrepLadder has given it,
Concise, everything in the one. Yeah.
FMG followed by NEET PG followed by
I know.
NICET, and try to bookmark those questions which you are underconfident in rather than those which you are easily able to attempt.
Definitely
Because they're already there in your they're already there in your memory. My next question comes is that Angad, that let's say someone is starting preparation from now. A lot of people would have not 90% of people would start preparing for now for December FMG. What would your advice be at this point of time to these people? And what should they do? Should they go for the main videos of platforms? Should they do rapid revision videos? Or should it be a mix and match depending upon the subject? How should they integrate the previous year question? And you have already talked about that FMGs are not adequate. You should definitely do NEET and INI papers as well. But what would you guide for people who are, let's say, preparing for the December FMG?
So it will be simple. It's only a combination of three things I would suggest. If a person is right now starting, there is no time for main videos. But what I would suggest is slightly a bit different. If there is a difference, I want them to check it personally. If there is a difference especially for the minor subjects, if there is only a difference of 4 to 5 hours for the minor subjects, I would suggest them to do the main video. The reason behind that is because, sir, in any rapid revision, either it is of any platform, the rapid revision which will be there will cover around 75%, which means out if there are 10 questions, 7 questions can be covered. But the main videos cover around 10. So, sir, what I'm trying to say is that just by giving 3 to 4 hours extra, if we're able to secure 10 marks, because, sir, there are multiple people, my friends who worked so hard and they got stuck by 149. Just by 1 mark, sir, they were not able to pass the exam. So, over in this exam, really 1 to 2, 3 marks really matter, sir. So, what I would suggest everyone would be that for the major subjects, start your rapid revision. And to be honest, for PrepLadder has literally the gold standard of rapid revision. Either it is FMG, NEET PG, or any of the others, even INI-CT, to be honest. The rapid revision is really good for them. Along with that, you have to do grand test. What I would suggest is, sir, till up to November, give every 1 month one grand test. And along with that, PYQ, sir. And then after November, if you're having at least 2 months, 15 days, 15 days, 15 days, do one grand test. So a combination of three things, sir.
I get it. So I'll summarize it for people. Basically, the three things that you are telling is, the first one is no time for main videos, go for rapid revision videos. But a very important caveat that you are telling is that for short subjects, let's say the short subject total is being taught in 12 hours and rapid revision is 7 hours or 8 hours, then in that scenario, maybe do the main videos, because those 3-4 hours will fetch you 3-4 extra marks. But obviously the main subjects, the main is going to be 100 hours or 50 hours, and rapid revision is going to be 10-15 hours. In that, go for the rapid revision videos. Fair enough. The second part of the thing, a 3-pronged strategy you said, was practice. That involves, first is GT, give 1 GT every month, every 3 to 4 weeks. And the third part is the previous year question. And from the previous year question, you specifically already have mentioned, please don't restrict yourself to 5-year FMGs. Definitely do 5 years NEET PG and 3-year INI-CT as well. And together these things and a final revision will get you through the exam in FMG. All right.
Ji, sir.
So so we have covered the strategy for a December one. We have discussed why people faltered. The major reason being them focusing exclusively on just FMG PYQs, not taking into account that the paper in general in NEET PG INI has become clinical, so FMG is also becoming clinical. And obviously, like this paper was slightly moderate too hard. Yes. And since it was moderate too hard, it was a bit slightly tough to crack. Any last motivating words for all your FMG friends out there?
So I would definitely say to have hope. always have hope, because sir, it's not like I'll talk about myself, sir. It's like I don't feel like even I'm a topper or something, I'm something brilliant. I'm just an average person, sir. I gave my hard work every day, like that mantra, focusing on every day as an FMG exam. One thing was there, sir. I had a lot of breakdowns, to be honest. I had palpitations, to be honest. I In the month of April, I was very stressed out. But then my mother told me one simple thing, because I was really afraid ki what will happen, what will happen. So my mother told me, Angad, don't worry, because you are not God that you will decide how the exam is going to happen or something. You have to give your best. So what she used to tell me is, Angad, go and stand in front of the mirror. You say that I can do it, I am worth it, and I'll definitely crack it. I used to say this, sir, every day. I used to say this every day, sir, because even though people say that it's kind of silly, it's like 5 minutes, and sir, I used to do meditation at least 5 to 10 minutes a day. That's a 5 to 10 minutes of day. I really credit that to my success also, because that being us as doctors, and sir, definitely you also have that experience, that we tend to utilize and literally each and every 5 to 10 minutes, and at times we forget our own health, our own mental health. And then definitely I would really emphasize on mental health, because sir, there were many people who were studying so hard, but just last day, because of the exam pressure, because of such huge questions, they were not prepared. PSM came like literally Shoaib Akhtar ka bouncer. So they really got frightened at the last day. And if they, like, if my friend, like, they also told me, if I was mentally well oriented, I would have done it much better. And sir, like, as I was mentioning, hope, I really credit it to my young brother as well, because I lost him during my MBBS period. But I always felt him mentally and spiritually all around me. So if I was tensed or something like this, I have his photo, and I used to have that, yes, I'm going to crack it, I'm going to crack it. And it gave me a good vibe. Like, even though you don't need positive people to be around you, but make sure that you'll make all the negative people away around you. You should make sure that is very important, sir, because we can't always tend to have another positive side, but we can actually eliminate the negative people around us. That is what I
Basically,
want to emphasize.
that you should definitely have. Just give me a moment. अगर I मेरा ना charge खत्म हो जाएगा.
No problem, sir.
So basically, what you're saying is that remove the negativity, 5 to 10 minutes of meditation, and that positive hope is a powerful thing. I don't know, a lot of my people might not have watched Shawshank Redemption, but if you have watched Shawshank Redemption, there is a line in that movie which says that hope is one of the most powerful thing, maybe the best of things, and no good thing is worth leaving, basically. And the fact that he was always hopeful, and the fact that he did meditation resulted in him being calm on the exam day, because every day was an exam day, so exam day was a normal day. And,
Definitely, sir.
yeah, and like we talked about, even I saw the result. There were so many people who were there just between 145 to 150.
True, sir.
Maybe just the exam anxiety got to them, and they were not able to breach that 150 barrier, right? So it's not that their hard work was not there. It's not that they were not intelligent, or they were not prepared for the exam, or they were not they were conceptually weak or anything. Probably just because of that anxiety, because of maybe losing hope, or maybe being too harsh on themselves. That's why they were not able to perform on the exam. And like you said, if you keep your hope, if every day is exam day, and if you just, and it's a very, very powerful technique. I would also say that even I have written it multiple, मतलब मेरे टेबल पे मैंने लिखा हुआ था, like you said ना, you said I can, I'm worthy and everything. मैंने अपने टेबल पे हर बार लिखा होता था, अभी नहीं है, but इससे पहले जब भी कोई एग्जाम्स दिए हैं, I can, I shall, I will. So I feel these, this just going in front of the mirror, or having someone tell you I can, I shall, I will, I can, I'm worthy, I will do it. And just repeating these things to yourself is a extreme confidence booster.
Definitely.
Nobody else, negative people, remove them. Positive people, keep them, and you yourself become positive. You yourself say this to yourself, and things are going to be fine. Right, Angad?
Ji, sir. Bilkul, sir. Simple, sweet.
Simple, sweet. Fair enough. Thank you, Angad. This was a really, really nice interview. Actually, and this was a really, I think a lot of people got the insight, and especially the part, I would tag that part as well. Especially if you're focusing for the December FMG, the way Angad talked about that three-pronged strategy, that is the most important part of the interview. And the other most important part of the interview is that if you're preparing for NEET PG and INICET, FMG अपने आप निकल जाएगा.
Bilkul, sir.
With that goal in the mind, and that is the reason he got such a high score as well, I believe. Right? It was not because he was not preparing for FMG. He prepared with the NEET PG and INICET in mind. And फिर obviously FMG का तो hill निकल ही गया, right?
Jesus.
So keep these two things in mind. These are the two most important getaways. And obviously, crisp, concise revision. Dr. Marwa helped. First aid helped. PYQs helped in that. वो चीज तो सब चीज वो तो अब इतनी बार बोल दी गई है कि सबको पता ही है ऑलमोस्ट, तो उसको हम रिपीट नहीं करने वाले. बट थैंक यू अंगद, थैंक्स अ लॉट फॉर गिविंग दिस अ वंडरफुल इंटरव्यू टू मी. थैंक यू.
जी सर, थैंक यू सो मच सर.